Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
This is KRWG Public Media, TV, radio, online. News that matters. Now, across the Mesilla Valley and the borderland, the stories that shape our community. From the KRWG Broadcast Center at New Mexico State University, this is Newsmakers.
Thank you for joining us for Newsmakers. I'm Casey Counts. We've been living with COVID-19 for 2.5 years now. 1 million Americans have died, including almost 8,000 New Mexicans. And the virus continues to mutate. The New Mexico Department of Health had an update recently with Dr. David Scrace, the acting Department of Health Cabinet Secretary. The update was held July 14th on the department's Facebook page. 7,972 New Mexicans have died, with 18 of those deaths happening within the 2 previous weeks. There were about 176 people hospitalized in the state. Compare that with peaks of about 750 during the fall of last year and the winter of this year. Only 10 people were on ventilators as of that date. That sounds pretty good. But there are some serious concerns with the new variants that have become dominant over the last few weeks and months, and we'll discuss those with our guest today, Dr. Dolores Gomez, the Chief Medical Officer with Memorial Medical Center. Welcome back to KRWG, Dr. Gomez, although you may not have ever joined us here in person.
I have not. This is my first time. I've mainly been on Zoom or on the radio, so thank you for having me.
Well, we're so glad to have you. Let's begin with the new dominant BA4 and BA5 variants and some of the issues that are being reported with testing and their ability to evade immunity.
Yeah, so those are our 2 in the United States over the last couple of weeks that have become the dominant strains. Just like most of the Omicron variants, they are very contagious. But most of the things that we have done thus far to kind of combat that, including vaccines, medications, we found though that because they're newer, we're not quite sure how well they are going to work against these new variants. And of course, thinking about that moving forward as we continue to mutate with Omicron or any other related coronavirus, how are we going to combat that moving forward?
One recent report from NPR indicated that these variants are evading home tests and even in some cases PCR tests. Do we even know how widespread that is at this point?
You know, at this point, it's a little bit hard to state. One of the tough parts, even though our state has said if you do a home test, please report that, because we don't really know the number of positive home tests or negative home tests that there are. But definitely there's something that we have to know as we continue to have these variants moving forward. We're going to have to evolve, just as the virus is evolving, to see how we continue to test and test appropriately. And that includes the home tests as well as the PCR tests.
So if someone is having symptoms and takes a home test and it's negative, do you recommend that they go a step further and get a PCR test?
Absolutely. We would say either get a PCR test. If you've been exposed and you're concerned, wait another 2 days and then maybe retest as well, because your test is only as good as the day that you do it. It's a point in time. It may depend how much virus you're shedding as to why it's not picking up. But if the symptoms are there, you've been exposed, you still want to do all the right things and maybe consider a retest.
We had some numbers on a statewide basis, but what can you tell us at this point about Dona Ana County, what we're seeing here, and of course surrounding counties, because obviously you see patients from other counties as well?
Sure, absolutely. You had mentioned, we're not seeing as many hospitalizations, so that's a good thing that we're at. The thing is again, this virus is very contagious. As of yesterday, our positivity rate in Dona Ana County is at about 33%. Now again, I don't know if everybody's reporting those, and probably not, so it's probably much higher. So as you see that positivity rate go up, you know you're going to have more cases, and there are those risks of more hospitalizations.
So with the inaccuracy in some cases of testing and people not reporting those results necessarily to the state agencies, do you find it difficult for medical professionals at this point to follow the data?
It does. It's a little bit hard. I will say that in the last month or so, since kind of the beginning of June, we have seen that positivity rate continue to go up. So I know that the numbers are higher. I can tell you, just being in an office setting or in the hospital setting, you're seeing more cases. So you know the numbers are going up, and it lets you know that. I think the difficulty right now, where the positivity rate was, which was very similar to where we were in January or February when we had a lot of cases. The difference though now is there's a lot less or loosening of what we do to help mitigate the spread of it. So the masks have gone away by and large. The state has said you don't need to wear a mask in indoor locations. And so that worries me as a medical professional that we're going to continue to see these numbers go up. And as we start to hit the fall and winter, what are we going to be dealing with at that time?
And I want to get back to masks just a little bit later, but let's move on to vaccines now. And according to data from the Department of Health, in our most vulnerable groups, we'll look at some full data. For those 65 and over, 99% have received at least one dose of vaccine, 95% have received 2, and 75% have had 1 booster, while 33% have had 2. Adults 18 and over looking pretty good, with 92% having received at least 1 shot, 79% having received 2, and 61% getting 1 booster. For 12 to 17-year-olds, we see about 70% have received at least 1 shot. It's only 40% for 5 to 11-year-olds. And with recent approval for a vaccine for our youngest children, aged 6 months to 4-year-olds, it's not surprising to see just under 3% have received a shot. Dr. Gomez, are you satisfied with these numbers?
I'm not, and kind of as you were presenting that, you can see that in our highest risk groups, those over 65, our vaccination rates are much higher because we've really emphasized that. But you can also see that second booster is much lower. So we do know that immunity wanes, and in order to kind of help fight this or even getting severe disease, we have to continue to push the need for those vaccinations, even if we know that they may not be as effective, but it's definitely better than nothing. So I would love to see those numbers go up. I would love for us as a community to continue to talk about the importance of the vaccination, just like we do about any other vaccination that we do require.
And I understand there's a new vaccine coming out in maybe soon, a week or two. What can you tell us about that?
Yeah, so that's the Novavax vaccine. There's a lot of hope behind it. Of course, again, with the 2 that have been the most effective, our Pfizer and our Moderna, they are mRNA vaccines. The Novavax is a little bit more like our traditional vaccine, so very similar to like the hepatitis B vaccine that we get as children or as we get older. And so they're hoping that because it's not so much experimental as a lot of people kind of thought about Moderna and Pfizer, that it may encourage some people to be willing to go and get it. And they are seeing some pretty promising evidence that it is effective against our current variants and Omicron in general.
Do we expect that people will respond in the kind of numbers that we saw initially, or do we think that this vaccine might lure some folks in who were maybe a little bit suspicious of those original ones?
I think the hope that it might lure some people in because it isn't so new. It follows kind of what we're used to and seeing in traditional vaccines and how it is used. It takes an inactive part of the virus particle and puts it into another virus to then be given. And so we're hoping that people that have been a little bit leery about doing it may be willing to do it. But I think also there's become a little bit of complacency behind COVID. I think also because it's not as severe. People think, well, I'll just fight through it and I'll be okay. But as we're learning more about long COVID, even in those who maybe don't get as sick, still may have symptoms and effects from COVID down the road.
And we're going to get back to long COVID as well. But let's talk a little bit more about boosters. Second boosters have been approved for those 50 and over and those 18 and over who have other risk factors. What are the risk factors that concern you the most? And maybe this is an opportunity to remind people why they should get a second booster.
Sure. It kind of continued to trickle down. In age 65, we know age is one very important thing, but it's those immunocompromised conditions, those people with active cancer, especially certain types of cancer. But it's also important in people who may have a BMI that is high, those with chronic conditions like diabetes, chronic kidney disease, hypertension. I would love to say we don't see that much in our community, but that makes up a large majority of our population. So if they know I have this going on with me, I should go and protect myself as much as I can and get that vaccine done.
Do we know at this point how much boosters are helping, and should everyone be getting them?
Yeah, I think we're definitely seeing a benefit, and especially if they've continued to study and see, like, when does that immunity wane? Even though we continue to have new variants coming out, we're still seeing good efficacy. We were super excited when these vaccines first came out because they said, gosh, 90% efficacy. You don't see that in a lot of vaccines. Our flu shot isn't even close to that number. The numbers are less, but they're still well above 50%. They're probably still close to 70%. So that's still a really good effect that you can get from the vaccine, and important, especially if you could have serious side effects or have serious enough disease that you end up in the hospital and intubated.
And why hasn't a second booster been approved yet for everyone 18 and over?
That's very interesting. I was just talking to some of my colleagues about that as we're seeing our positivity rate go up. And if you follow the data on the internet, the New York Times posts every Monday and Thursday, you can see the colors again changing on throughout the United States. We're going from green to orange to red in a lot of areas. I'm suspecting that before we get closer to start of school, although we're starting school in a couple of days, that we may see that they will release and say we need to give those boosters to our younger patients.
And in fact, when our program airs, school will be back in session, first classes Wednesday. So do you feel that our educators and our students alike, especially those that do suffer from risk factors, will be working and learning in a safe environment?
I worry a little bit. You're dealing with a young population who, in general, the way they function is that they're not vulnerable to anything. So they're open to, I'm not worried that this is going to be me. As we've continued to see in our younger population, they often don't tend to get severe disease. But you're in an environment that is enclosed. Ventilation is affected by that. We know the contagiousness of the current variants, and it's very easy, even if you're at 6 feet, that there is going to be an easy chance that you could get infected by somebody who currently has the virus. That I do worry, again, without having some other protective measures like masks, that we're going to see those numbers continue to go up once school comes back in.
Let's move on to treatments for COVID-19. The New Mexico Department of Health referred to oral treatments as game changers for at-risk patients, but they have to be administered within 5 days of the onset of symptoms. Have you found them to be effective, and are people getting to them in time?
Yeah, I think I have seen a difference in that. Now, again, the same thing as we talk about those that are at most risk for severe disease are the ones that we want to be able to get the oral medications. Paxlovid has been the one that has shown the best effect, but it's making sure you get them there. I think providers, and I would ask our community providers to be very aware to make sure they're asking their patients, even before they may get sick, is to say, if you get sick, please let me know right away. Please get tested, so that way we can make sure you're in that time frame to receive the medication.
And even the game may have changed before the game changer even came on the market, but are monoclonal antibodies still effective?
So right now, only one has been shown to still be effective at this time. Beptolivimab is the one that we are using currently, and the only one right now that seems to be effective against Omicron and its variants. It does have good effect. If you look at the NIH guidelines, it's an alternative therapy. They still recommend Paxlovid as our first-line therapy to use first. There is a medicine that we have used more frequently in the inpatient setting, but it has been shown to be effective probably next, and that's remdesivir. But it's an IV infusion taken 3 days in a row. That can lead to some logistical issues in doing that. And then your monoclonal antibody is next. The nice thing about that, it's a single dose. It's done as what we call an IV push. It can be given within a minute, and then you have to be observed for an hour, and then you can move on. So there is still.
Is that plentiful, available here in Las Cruces in southern New Mexico?
It is available. I know our hospital Memorial still continues to provide that service. We use one of our outpatient centers to do that. We're a little bit more tied at this point, not so much because we don't have availability of the medication, but as you've probably heard in hospitals worldwide right now, there's a lot of shortage of staff, and so that's been more of our difficulty in making sure that we can get that to patients.
What should everyone have on hand in their home just in case they do become infected?
So first thing, definitely have your home tests. Obviously, they released more in the United States where each household can get those free of charge. You don't have to go to the pharmacy to get those. You can have those readily available. You want to make sure that you have meds just for some of the symptoms you may be feeling. Fever, so have some kind of anti-fever medication available in the home. Things that you can do that wouldn't involve medication is how you sleep, constantly turning yourself, deep breathing. Those are important things to do as well. And if you've got some cough, having some medicines for that, just like you would do if you had some other virus that you just want to feel a little bit better as you're trying to get over.
Well, I am now the proud owner of a pulse oximeter and a non-contact temperature thermostat. What's the right word for it?
Oh, just a thermometer. That's
thermometer.
good. Yeah.
I'm glad I have you here.
Yeah.
And there's been some issues along those lines, and I want to move on to that in just a moment. Mm-hmm. Do you think people should be having those kinds of tools in their home as well?
I think there's good things behind them and some things that may give you some false sense of security within it. I think the biggest thing to know is if you're a certain way one day and things are worsening, that's when you need to go in and seek help. I think that's an important part. The pulse ox can be useful if your O2 sats, our goal is to be above 90%, but if you start to see that number drop, you also have to be aware, did I just do activity where as you're trying to recover from something, sometimes your numbers will go down a little bit, but if you rest, the numbers come up. So there has to be some guidelines in how you use it. And of course, sometimes it doesn't read the way that it should, and people get nervous.
Right, recent studies revealed that people with darker skin color are getting some, false normal readings. Mm-hmm. So were you surprised to hear that, and what do you do in that situation now in hospitals all over the country?
Yeah, so I think with that, and something that we've dealt with forever, and the things that we supply and make available are made for a certain community or a certain population. We need to know that we have to make sure our most vulnerable, including our marginalized population, is aware of the things they need to pay attention for if they're getting worse. The pulse ox should only be a small part of paying attention, am I getting better or do I need to seek care?
We also learned recently that multiple infections can increase the risk of lasting effects, something long haulers have been dealing with for a long time now. Mm-hmm. Are we any better at treating lasting symptoms, and what concerns you the most about these ongoing problems people are having?
Yeah, so that long COVID, we're starting to learn more now that we are more than 2 years into this process. What we're learning is that it's not just affecting those that have been hospitalized or who have been the sickest. It's happening in patients who have gotten sick, never required hospitalization, may have been very mild in their symptoms, but they're having these other long-lasting effects, including fatigue, including continued waxing and waning fevers. Some people, unfortunately, have even had neurologic changes, pins and needles, different things like that. So I think being aware that even though you may not be hospitalized with this disease, it can cause long-lasting effects, which affects our workforce, which affects people mentally as well and what's moving forward. So as we continue to move forward, we're learning more about it and being aware of it. How to make it better, it's still just time right now, and what we can do to learn more about how this works and how we approach it moving forward.
We ended the pandemic phase of the virus a few months ago and entered the endemic stage, according to Dr. Anthony Fauci, but to many it doesn't feel like that. It doesn't feel like the pandemic is behind us. What goes into making that determination, and where do you say we are?
Yeah, so looking at it officially, it's based on how many numbers you're seeing worldwide. Are you starting to see the numbers wane overall? So not just what's happening in the United States, but what's happening everywhere. I think the thing that's been difficult is in the U.S. because we have unfortunately led the numbers almost throughout the whole pandemic. I think for us as providers, we don't really see that much of difference other than what's happening in the hospital setting. Not as many patients coming in, but we're still seeing those high numbers of positive infections happening.
And it certainly hasn't become seasonal at this point. Do you think that will happen?
I think the hope is the natural course of a virus like coronavirus is that as it moves forward and people build immunity or you get vaccines towards it, that it becomes less infectious. It becomes more of what would be like a common cold. But this virus hasn't behaved specifically like that yet. I think everybody has the hope that that's what we're going to see. But we still have time, and we still need to do what we need to do to try to make this better.
So for now, what are your recommendations for masking?
I wish I could make a change back into what the state was doing in the past, even when our numbers were so much lower. But right now, because of how infectious the current variants are, going back to masking indoors, I think would be very important to do. You know, we've done it for so long. I've gotten so used to my mask always just being with me that I don't even really pay attention to it anymore. It's as much as like when I get in the car that my seatbelt just goes on automatically. But I think that can help prevent this continued spread that we're seeing. The outdoors piece, there had been a little bit of data that maybe even outdoor activities where there's a large group, you should consider wearing masks for that as well. I think that's one way also to do that. And again, think about it as protecting yourself, and also if you happen to be ill, that you're not going to be spreading that to those closest to you.
Now, let's move on to monkeypox. New Mexico has a handful of cases of monkeypox reported, and obviously this is a very different virus and one that has a vaccine and treatments. However, there was no vaccine available in the state when the first case was reported, and now there are a little under 400 that are expected to be arriving soon if they've not already. Who should get a monkeypox vaccine?
So the good thing with monkeypox, I will say, is the exposure is very different than the exposure to something like COVID, where you're just close contact and those things make a difference. People have to have active lesions. You have to come into direct contact with them. Where we're seeing that happening in the highest rates of people are those men who have sex with men. It does tend to happen commonly in the skin areas of the genital area, so we know those are the ones we want to target first. And if it starts to grow within the state, those people that are testing them for that, those laboratory workers that are going to be having to take the samples to figure out what's happening, are probably our greatest risk. So right now, the good news is it's a little bit harder to actually end up being exposed to it. But if you are, then yes, post-exposure, we still have a good treatment to help make this better.
Now, there has been some criticism of our response to this. Was that response indicative that we really haven't gotten our ducks in a row when it comes to pandemic response, or for the next one?
I think that might be why people are a little bit more concerned, because we saw what happened with COVID and kind of how we were dealing with that. But that was a brand new virus. And it's a little bit harder to deal with something brand new than something that we do already have treatments for. I think it's still important, yes, that you're getting that going. The chance that this could explode as much as COVID has, I think is much less, because we already have something ahead of the game for it. But yes, I think if you know, especially in areas where it's grown a lot more like New York, the response to kind of help the spread get less has been a little bit slower than expected.
The flu of 2021 was pretty much non-existent. Let's talk a little bit about what the last flu season looked like and what we are anticipating for this upcoming flu season. It's not that far off.
Yeah. So usually starting around September, October is when we start recommending you need to go and get your flu shot. A little bit better that we are off this year, even though we had such a mild number last year. At least this year we have an idea of what we should be providing for the vaccine, because we did have the cases last year. I think we'll probably see the number be a little bit higher, because again, now the masks are gone. We still had some mask wearing happening a lot last fall and winter, that I would expect that we're going to see higher cases this year. So all the more important that we're recommending, just like we did every year before anything else happened, is go get your flu shot. That includes from 6 months and up to help protect yourself from infection.
And what would you say to folks who are reluctant to get flu, any kind of vaccines additional for their little ones? It hurts, it's scary, but I think that people have been more reluctant to get the COVID vaccines, obviously, than they have been historically to get flu vaccines. So what do you say to parents who are just concerned about the idea?
I think, again, you need to have that conversation with your provider. Please be willing to go in and talk about it. I don't want people to think that just because you say no, the provider's going to turn you away. Hopefully most providers will say, let's talk through this and let me tell you the importance behind it. Obviously, we don't want our child to hurt, but if we think about what would be the consequence of not doing it and then getting infected, and then what that child has to go through, or anybody has to go through to get over that infection if they get hospitalized. I think if you look at it from that perspective, then I think people are more open to understand why we think that this is an important thing to do.
And the dose for 6 months to up to 5 is a 3-dose series, right?
For influenza?
No, I'm sorry, for COVID.
For COVID,
Yeah.
yes. For COVID, yes, it's a 3-dose. They get their first dose, and then within a 3 to 8 week window, second dose, and then the third dose happens 8 weeks from the second dose.
All right. All right. Thank you so much. That's our time for now. Dr. Dolores Gomez, the Chief Medical Officer for Memorial Medical Center. Thank you for joining us on Newsmakers, and in the same week on Voice of the Public, taking our caller questions on KRWG-FM. So good to see you.
Thank you so much, Casey.
And join us this week on KRWG Radio every weekday morning. It's Morning Edition from 5 a.m. to 9, Fresh Air at 11, followed by Here and Now from noon to 2, and All Things Considered from 4 to 7. KRWG News is always online at krwg.org, and we'd like to hear from you. Email us with story ideas and video submissions. The address is feedback@nmsu.edu. For all of us at KRWG News, I'm Casey Counts. Have a great week, and we'll see you next time on Newsmakers.